Hey family, it's Sky Houston here, and today we're going to have an intricate conversation on a topic that's not foreign to a lot of us. October is known as a few things. A lot is pegged for the month of October, but one thing, you see a lot of people wearing pink for a good cause and a good reason, and it's going to be a reason we do something different today. And for the conversation, we're having a critical topic that affects a lot of our families, from our aunts to our sisters, to our men. But ladies and gentlemen, today we're going to talk about breast cancer awareness. I know you've heard about it, you may have experienced it, but I want to have the conversation about a few things we don't talk about enough. This segment is brought to you by Aetna's Black Health 365. They are sponsoring this to have this critical conversation, this extended conversation. And I want to go ahead and invite our guest in today so we can get that convo going. If you would, ladies and gentlemen, please welcome to the show with me, Dr. Stephanie Whyte. Dr. Whyte, are you there?
I am here. Thank you for having me.
Thank you for being here. Now, listen, I know there's a doctor in front of your name. So if you
Mhm.
would tell us what your doctorate is in before we get going.
It's a doctorate in medicine. I am boarded in pediatrics.
All right. Well, thank you. Thank you for the time and the talent you have and your expertise. But I'm gonna ask your favor for a moment. I'm gonna put my paper down and I feel like I gotta squabble up on something for a moment.
Okay, go right
I know you
ahead.
like to keep it real professional, but this topic hits home for me. I've lost an aunt to it. I've lost a church member to it, and sometimes I'm ready just to have gloves off and fight. It's Breast Cancer Awareness Month, and not just breast cancer, but cancer in general really affects our community.
hmm
Not too recently, we lost D'Angelo,
hmm
okay, to another form of cancer. But my point is, I'm sick and tired of being sick and tired of it affecting our community. So if you don't mind today, please pardon my passion, but I really want to have a heart to heart about cancer on today. Is that all right?
That's perfectly fine.
All right. So, with that being said, I know we hear about cancer, but really tell us, what are the numbers looking like? Like, how prevalent is breast cancer still for us here in the United States?
So, breast cancer is the second most common cancer and the second leading cause of cancer death among women in the United States. The cancer accounts for about 30% of all new female cancer diagnoses each year.
Wow.
And then for those who have an average risk, it's 1 in 8 who are likely to get breast cancer in the United States. So
Now,
one out of every 8 women, sorry,
one out of every 8 women
with an
are diagnosed
average risk. Mhm.
with average risk. Now, with that number, it doesn't seem like it's coming down. Is that number rising? Is it safe to say that number is actually going up?
So I would say the number is static. What the issue is when you look at, say, the difference between African Americans and white women, the incidence is the same. What ends up happening is there is a higher death rate in the African American community, roughly 40% higher death rate. And we have a lower survival rate for every known stage of cancer. And we're more disproportionately affected by some of the types of cancer, like the triple negative breast type or the inflammatory breast cancer. And we're more likely to be diagnosed younger and at a more advanced stage of the disease.
Wow.
So it's similar in incidence. It's how it plays out that's a bit different.
Now, what blows me away is hearing you say we die at a higher rate from this form of cancer. Why is that?
So it's about education and awareness to the point that I said we're more likely to be diagnosed younger and being at more advanced stage of disease. So health is wealth. So getting diagnosed early leads to better treatment outcomes.
Okay, so we're not finding out quick enough. Is that what I'm hearing? We
You're
wait too
hearing
long to
that,
go to the doctor.
and that's the whole point of having a whole month around awareness, right? Reminding people to get screened, to go get mammograms. And traditionally 40 is the age to get mammogram screening done for the average risk individual.
Okay, now I've heard that it's recommended to get it age of 40,
Mhm.
if I have a family member or a history in my family, am I able to get it earlier than the age of 40?
That is an excellent question. So I made a point of saying for those who are at average risk, if you're average risk, you don't have a personal history, you don't have a strong family history, and you don't have a known genetic mutation called, it's usually noted as BRCA1 or BRCA1, the BRCA gene, or you haven't had any chest radiotherapy, radiation therapy before the age of 30. So those are the people who are average risk, and that's age 40 is usually when it's recommended. If you have a higher risk, you typically have a family history, have known genetic mutations in the family, and your doc may recommend that you start having those screenings as early as age 30.
Now,
So
what
what's
would you?
important, I'm
Mhm.
sorry, what's
Okay.
important is that you are aware of this, you know your family history, and that you share this information with your doctor, and you can start formulating what that plan is.
Okay. Now, on social media these days, we see a lot of posts and reels. Everybody's an expert when it comes to health, things that they can do to prevent it. If I drink my green juice every day, I won't get breast cancer. What would you tell somebody who's looking to kind of take down those risks of possibly getting it? Can I drink my green juice and it prevent me from getting cancer? What things can I do to prevent?
So I'm not going to sneeze on the green juice now because we do need to maintain a healthy lifestyle, right? So keeping a healthy weight, staying active, exercising, balanced diet with your fruits and vegetables. So your green juice is up in there, limiting your alcohol consumption and not smoking. All of that under a healthy lifestyle is going to be critical for any cancer. Now, I said limit. I
Limit.
said limit. I did not say eliminate. I said limit, right? And then I did say avoid tobacco. Two different choices of words there. But again, around maintaining a healthy lifestyle. But screenings, staying on top of screenings is primary, right? Again, we talk about health being wealth, and the ability to diagnose early
Yeah.
leads to an early intervention and treatment. So adhering to what the guidelines are for what your level of risk is. So again, average risk, we're looking at about age 40. Knowing what your family history is, because if you know that you have a greater risk because, you mentioned people in your family who've had it, then, that that's a conversation you have with your physician, so you can create a plan to say, how do we address what my care should be? What should my level degree of screening be? And getting that done routinely. And then these are not just decoration, right?
Wait,
So they're
wait,
not just
wait,
hanging there.
wait. You did that, and they didn't really catch that. So you do this, sis. Let's talk about what this means.
Yeah. So you need to practice breath awareness, right? So they're not just for decoration. You need to look at them. You need to notice something's different. Are they misshapen? Do they seem lumpy? Is the skin looking different? Do they feel different? And if that's the case, you need to talk to your doctor about that as well. So you need to be aware and pay attention to what's going on with your body.
Yeah. So if I'm in the shower and I'm rubber dubbing and I
Yep.
see something, that's a Key Sweat song.
Yep.
Something just
Yep.
ain't
Yep.
right.
Yep.
What do I need to do immediately?
Well, you need to pay a little attention to it, right? Say, okay, what exactly isn't right? And then you need to reach out to your doctor, make an appointment and say, hey, listen, this is what I discovered. I was in the shower. This is what I noticed. I'm concerned. I'd like to come in for an exam.
And are there any other symptoms? I know that's the easy physical. You feel something that's not right.
Yes,
What are other
yes.
symptoms of breast cancer? I don't think I've ever heard anybody say, what are other things that I may just think is, just
Yeah.
happenstance?
So, I think the good reason for that is that it can show up in different ways, right? And for some people, they may not be any obvious signs. But again, when you talk about being in there and showering and noticing something, it could be a lump or a mass. It could be in your underarm, or it could actually be on your breast, and it can be outside of your menstrual cycle. Because, as women, hormones, glandular changes, you can get a little lumpy, bumpy in that area. You can get changes in the shape, the size, or the contour of your actual breast. You can also get changes in how the skin looks. It can look kind of dimpled. It could look kind of puckered. You might notice that it's red or scaly. It can get tender or discolored. Your nipple might start to have discharge or discoloration, maybe even bloody discharge. Or there might be a firm area. All things that are not typically normal. And they're cause for alarm and for follow up, for you to reach out to your doc and say, something is different here. Let's get this investigated. Not let's wait and see what happens, but let's go and see, get it investigated.
My right eye got sensitive when you started talking all of the symptoms. I'm a sensitive girl. Like, listen, pay attention to your body and give
Right.
yourself the grace. I don't think I've ever heard this before either. Can you remind us what are the stages? Because you said we find out really late. We're at what, stage 4 and 5 by the time we find out? What are the levels?
So the stages are actually done once breast cancer is determined, right? So they're classified based on the degree of the invasiveness of the disease. And it's usually 4 stages with most cancers. And depending on where they're infiltrating and if they've gone to different areas of the body, that's how they're graded and staged. So they're typically 4 stages.
Okay, thank you for that. What initiatives are like CVS Health and Aetna undertaking to support and give preventative care? If you could go over a few of those for us.
Thanks for asking about that. So we're actively working to enhance breast cancer screenings and preventative care. We provide educational resources to help increase awareness and really promote the importance of breast cancer screenings. Additionally, Aetna supported what was the first national study on community-based use of genetic tests for cancer risk. And this study was made possible by a $2.8 million grant to the University of South Florida and done in partnership with the National Institutes of Health. CVS Health has expanded its women's health service offerings at Minute Clinic. So this includes an augmented women's health annual exam, which includes cervical and breast cancer screenings for women over the age of 18. And our Aetna clinical policy for mammograms is designed to ensure that our members receive the right care for their unique needs as a part of our commitment to continue to help our members live healthier and longer lives. And that means supporting women having annual mammograms as a part who have average risk at age 40 and older. And of course, we're going to continue to encourage our members to get preventive screenings, such as mammograms, to address health issues before they become serious. And, my Dr. Whyte edit, health is wealth, and early detection is key.
Absolutely. This is a part of Black Health 365 powered by Aetna. I have one more question, and I asked it flat-footed, straight, no chaser. Dr. Whyte, we get accustomed to seeing pink all the time. We go to all of the runs and the walks. Like, we know about Breast Cancer Awareness Month. We have family members. We wear the pink ribbons. But what is it working right there all day, every day with it? What do you still feel like people are not getting and you wish they knew this one thing? If you could say this one thing you wish they knew and would take action on to change the trajectory of their lives, the next generations, what would it be? If you have to shake us and say, Black people, 365, I know we got it. Pay attention, do this.
So, and I'll share it personally. It's about taking ownership for our own health and not waiting for something to happen and being very proactive. So when we talk about screenings, get the screenings, do them. Don't wait for something to happen and occur. And when something does happen and occur, wait to see how bad it is, because by that time, you're behind the 8 ball. Just be ahead of it. Be ahead of it, and don't be afraid to address it.
Don't be afraid to address it. I love that. We're in this thing together. I love this extended conversation. October is going to end, but this disease, this fight will not end unless you fight it stronger. Okay, so people, let's do it. Let's get the screenings. Let's get the early detection. And like she said, Dr. Whyte said, let's spread the word. Well, thank you again, Dr. Whyte. We appreciate you being here, and we appreciate
Thanks
you being
for having
in the
me.
fight with us.